Good morning, everybody. This is Doug Reen from Strategic Services Group. I genuinely appreciate your dialing in this morning, and I have the privilege of introducing Larry Grudson, our speaker this morning, who is going to tell us all about what's next in healthcare reform. I want to tell you a little bit about Larry, who has more than 35 years of experience practicing employee benefits law, comes out of John Marshall Law School, and spends pretty much his full-time focus on employee benefit programs, healthcare reform, and walks through this stuff daily. So we're very privileged, very excited to have Larry, and know that we'll also be having him back every other month throughout the year, as we have 6 seminars throughout the course of this year. So with that, I'm pleased to introduce Larry Grudson, and thank you very much.
Thank you very much. I've been following this. I've been following this ever since it was passed in March of 2010. The government's been very slow in getting out guidance. Just recently, at the end of December, they released guidance on the employer mandate, which this presentation will discuss. Now, one thing you're going to see from this, it's a very complicated situation to determine whether you're a large employer, what the penalties are, what your responsibilities are. As I indicated at the when I first introduced myself at the beginning, there are slides, and then there is an explanation of the employer mandate that I sent you last night if you registered. If you didn't get a copy of it, please email me. My email address is at the last seminar. At the last slide, and I will send you a copy of all the material. Now, in the dashboard there, if you look at the dashboard, go to the tail end of the dashboard, you see a question tab. At the tail end of the presentation, after I finish, I'll take your questions. So please, if something during the seminar is not clear, or if you just want to ask a general question, please do so. The first thing I'll do is do a quick review of what's happening in 2013 and 14. First of all, there's a new P-Corps fee, which is due by the end of July 2013. I will discuss what a P-Corps fee, what it is, who has to pay it. If you're insured, the insurance company will pay for it. If you're self-insured, you'll have to pay for it. Also, health FSA contributions will be limited to $2,500. I'm getting a lot of questions on that, and it applies to the first plan year beginning in 2013. Also, there's a new hospital tax that is in effect right now. It's an additional 0.9% imposed on income of high-income individuals, $200,000 for individuals, $250,000 for joint. You, as an employer, don't have to withhold that additional amount unless that individual's income exceeds $200,000. Another new tax that comes in this year is a new 3.8% Medicare payroll tax. It applies to unearned income for high-income individuals, $200,000 for individual, $250,000 for joint. And just remember, if your income is below that level, that 3.8% additional tax, and this is net investment income, doesn't apply. As soon as your income goes above that level, then all your net investment income will be subject to that additional tax. Now, there's also a new notice to employees about the exchange and subsidies that's supposed to be given out by the March 1st, 2012. I've heard that it will probably be delayed until June, but no official guidance has come out yet. So please understand that. We should be hearing in the next few weeks when this new notice is going to take into place. But again, when this is applicable, you as an employer have to give every employee a notice that they can go on the exchanges, what the information on the exchanges are, and if they go on the exchange, they're going to lose any employer contributions, but they could be eligible for credits and subsidies, which I will be discussing. Now, what's important sometime during 2013, if you're an employer that has seasonal or we call variable hour employees, you have to make a concerted effort during 2013 to count how many hours those individuals have. Because in 2014, you have to start offering coverage to all full-time employees. Now, for those employees that are full-time that work 30 hours or more, it's a no-brainer. Starting in 2014, the maximum waiting period is going to be 90 days. After 90 days, you have to offer them coverage. It's going to coverage on the 91st day. It's going to be tougher for those employees that either are seasonal or what we call variable hour, whose hours are not a steady shift. They may work part-time some parts of the year, full-time the other parts of the year. And the question has come up, well, do I have to offer them coverage? And the answer is, and you'll see this in the next few minutes, it will depend. It will depend on whether they work full-time hours on average during a determination period, which I'll be discussing. So this is a complicated area. The IRS has created safe harbors. And if you determine some of your full-time, some of your part-time people are full-time, so starting in 2014, you have to start offering them coverage. Now, as a responsibility as an employer, if you're a large employer, which means you employ 50 or more full-time employees, then you have a responsibility in 2014 to offer all full-time employees coverage and their dependents. If you don't offer them coverage, then you're going to be penalized. Now, I'll be talking about that, but the first step in the road to this is that you have to determine, and especially some industries are going to be hard hit. Restaurants, fast food restaurants, park districts, schools, temp agencies, nursing homes, any employer that offers employment to individuals whose employment is not steady. Sometimes people work on a project basis. So you have to understand that you have to start counting hours during 2013, and I will explain that. Then let's look at 2014. 2014, there's going to be new cost-sharing limitations for any small employers and individual plans. There's going to be limitations on out-of-pocket limits, cannot exceed HSA limits for high-deductible plans, and the maximum deductibles cannot exceed $2,000 for single and $4,000 for family. This applies to all non-grandfathered plans and the individual small plan market. It doesn't apply to large employers. Please remember that. Also in 2014, there's no more pre-existing conditions that will probably hit the individual plan market much more than the small plan, than the employer market. But just note there that because people may have access to coverage in the future, your COBRA participation in the future may go down. And that applies to all plans, both insured and self-insured. And during the presentation, I will tell you what requirements are for small employers, which are for large employers, so you have a general understanding. But there is a lot to absorb here. Also in 2014, for the first plan year beginning 2014, now the waiting periods cannot exceed 90 days. Now please remember and note there that the 90-day limit is what we call a hard limit, which means they have to be eligible after satisfying that, or they have to be eligible on the 91st day. If you have a requirement that they have coverage beginning the month after satisfying the waiting period, then it won't apply. You could do 60 days eligible at the beginning of the month after completing 60 days, but you can't do 90 days. You have to be eligible on the 91st day. Also, there's new rules on new wellness incentives. In the past, wellness incentives have been around for a few years. And if you have what's called a standard-based wellness program, you can do a differential on the premiums. So on a standard base, if you quit smoking, lose weight, and they have to satisfy certain standards to meet those requirements in the past, those were 20%. The differential and the reduction could be 20%, or the penalty could be 20%. Starting in 2014, it's going to go up to 30%. And for smoking cessation programs, that differential can be as high as 50%. But it must be pursuant to a wellness program. Also, too, there's going to be, starting in 2014, there's going to be new reporting requirements to the IRS, and I'll be talking about this, that you have to report your coverage, and this is where the IRS is going to determine whether to penalize you in the future. So this report will be due in 2015 for 2014. And basically you have to tell the IRS exactly what coverage you offer to the employees, and they will look at the information from the exchanges and then determine whether you will or will not be subject to the penalties, which I'll be discussing. Also in 2014, there's new premium credits and subsidies for individuals and for employers, and provides families earning up to 400% of the poverty level, which is for a family of 492.2, with certain premium credits and subsidies. Now, for those on Medicaid or for those who are covered by or are offered affordable minimum essential coverage, they can't get any premiums, credits, and subsidies. But for many small employers under 50, you may have to make a decision starting in 2014 whether you want to continue your group health plans. Because in some situations, if you don't offer coverage, the maximum, especially for your lower paid people, the maximum premium they will pay on the exchange is 2% of their salary. So if somebody is making, for example, $24,000 or $22,000 a year, and they have a family of 4, they can go on the exchange, purchase family coverage worth $12,000, and they pay a premium a little over $460. All right. So again, these are decisions you have to make over the next few months, starting in 2014. Now, supposedly the state-based exchanges will be up and running for individual and small groups in 2014. I'll be talking about what's happening with the exchanges, what they are, what they do, and what the current status of the exchanges are. So in 2014, only individuals and small employers can go on the exchange. Each state will determine what's a small employer, and then large employers can go on in 2017. Now, for individuals, you can only go on the exchange to where you are residing. So if you're residing in Michigan, then you can only go on the Michigan exchange. If you're residing in Indiana, then Indiana is the exchange that you go to. Another aspect in 2014, this is for non-grandfather plans, you have to offer coverage for clinical trials. So if you have an individual whose provider says this person would benefit from a clinical trial, then you have to cover that. And that covers for any non-grandfather plans, either insured or self-insured. Now, the big news in 2014 is going to be both individual and employer mandates. Every individual must purchase coverage in 2014 or be penalized. And the penalties are not severe, and I'll be talking about that. For employers, this mandate only applies to large employers, and that's defined as any employer that has 50 or more full-time employees. Now, you don't get off the hook if you are an employer that employs a lot of part-time employees, because we do full-time equivalents, and I'll be talking about that. But only large employers have to offer coverage. Now, your responsibility as an employer is to offer affordable minimum essential coverage. What does that mean? Affordable means that no premium cannot exceed 9.5% of the employee's household income. 9.5%. And you say to yourself, how can I ever know what the employee's household income is? Well, the IRS has created 3 different safe harbors that you can use: W-2, rate of pay, or 30 poverty level as a way of understanding and making sure that your premium they pay is not more than 9.5% of that figure. Now, that's only for individual coverage. It's not for family coverage. But the IRS just came out a few weeks ago and said the employer has to offer dependents coverage. Now, dependent means dependent children. It doesn't mean a spouse, but you have to offer coverage, but the employee has to pay for it. Now, in some situations, this employer mandate, and I'll be talking about this, only applies for plan years beginning in 2014, not January 1st, but there's some conditions to that. Let's look at the changes in 2014. What do you have to do this year? Health flexible spending account changes. Now, in the past, it was the employer that set the limit on the coverage, and you as an employer could set it. It could be any limit at all. There was no IRS or code-imposed limit. Starting for plan years beginning in 2013, the limit is $2,500. Now, that's based on an employee-by-employee basis. So if you have a married couple working for you, they each get a $2,500 limit. Now, if that husband, for example, or the wife works for another employer who sponsors their own health FSA and they're not related to you, the employer, that employee could get another $2,500. So if somebody works for an employer during the year, they put in $2,500 to that employer plan, and then quits and goes with another employer, they could have another $2,500 limit. Now, please remember, and this is a very common confusion here, it doesn't apply, that limit only applies to health FSAs. It doesn't apply to payment for premiums, dependent care FSAs, HRAs, or HSAs. Only contributions, salary reduction contributions, under health FSAs. Now, the only other time it may apply, if you have a situation when an employer gives an employer credit to the employee and says to them, well, if you put money in, I'll put money in, I'll do a match. And if that employer match can be redeemable in cash, that counts towards the $2,500 limit. Now, again, that will eventually be indexed. It has to be reduced if any short plan years. And again, generally, it doesn't apply to employer contributions. The only time it would apply employer contributions if any employer contributions can be redeemable in cash, where the employer says to the employee, if you don't use it or put it into a health FSA, I'll give it to you in cash. The IRS treats that as a salary reduction contributions. Now, employers have to amend their plan for the end of the 2014 year. I would advise you very strongly to try to amend that plan as soon as possible. Now, the next area is extremely confusing. And this is to get ready for the employer mandate in 2014. So again, effective for plan years beginning 2014, employers with 50 or more full-time employees must offer full-time employees and their dependents affordable health coverage with minimum value or face penalties. And for this purpose, full-time employees, anybody working on average of at least 30 hours per week is considered full-time. Now, a very common question I get is, suppose my contract says 35. Does it have to be changed? And starting in 2014, absolutely. So please, this is a new requirement that has to come into play, and you have to offer coverage. Now, another common question is, suppose I offer coverage and the employee doesn't take it. Am I on the hook? And the answer is no. Your responsibility as an employer is to offer coverage. If they decide not to take it, and if it's affordable health coverage of minimum value, then you're off the hook. But your first determination in 2013 is determine what employees you have to offer coverage to, and this is going to be a complicated situation. Now, solely for purposes of stability periods beginning in 2014, employers may adopt a transition measurement period that is shorter than 12 months but is not less than 6 months and begins no later than July 1st, 2013 and ends no earlier than 90 days before the first day of the plan year beginning on or after January 1st, 2014. Now, right now that sounds like gobbledygook. But eventually, I think when I wrap this section up, you're going to understand what your responsibility is. A stability period means a period in which you have to offer coverage. And in order to determine whether you have to offer coverage, basically a period that you have to measure is called a measurement period. That measurement period you'll be seeing in a few minutes is any period from 3 to 12 months. Now, once an employer picks a measurement period, they have to stick to it. Because the rules are coming out so late, the IRS said, okay, for 2014, You can still use a 12-month period, but for 2014, what we can do is you can use a 6-month period for 2014 and then use a longer period in future years. That's what they're trying to say. But this will become clearer as I go through it, all right, because these terms have not been defined yet. So again, for shared responsibility purposes, which means for the employer mandate, a full-time employee is anyone who works on average at least 30 hours per week or 130 hours per month. That's the requirement. Now, if you're an employer that just has full-time employees, there's no problem. In 2014, the maximum waiting period in 2014 is 90 days. Once that person completes 90 days, they have to be offered coverage on the 91st day. But it's going to be tougher for those employees that are called variable hour, such as part-time or seasonal employees, whose, depending on the project, the time of the year, the project they have, where they're working, their hours may not be a steady 30 hours per week. In that situation, there's going to be a challenge on when you have to offer those employees any coverage. The IRS has come up with 2 safe harbors that employers can use to decide if an employee has averaged 30 hours or more per week. One safe harbor applies to ongoing employees, and the other applies to new employees. Now, again, I just want to warn you, these safe harbors are complex, but both rely on the same defined time periods that generally must be measured in a uniform fashion for all employees. Now, here are the defined measurement periods. What we're trying to do here is come up with a period where we take an average hours. And the measurement period that you use to determine whether an employee is full-time is called a measurement period. And employees can select any fixed 3 to 12-month period starting any time during the year for determining whether an employee has averaged at least 30 hours per week. Now, for ongoing employees, this is called a standard measurement period. So this is where I'll say, okay, we look at the average hours during that measurement period. And whatever period you pick, any period from 3 to 12 months, if they average 30 hours per week, then basically what you have to do, you have to offer coverage during what's called a stability period. And after meeting the minimum hours threshold during the measurement, employees must be treated as full-time regardless of the actual hours worked during the subsequent stability period. So basically, the best way to remember this is to indicate the stability period is where they're offered coverage. So, and what they're trying to say in this slide, slide 17, is if you determine during the first measurement period that they're full-time, you offer them coverage. During the coverage period or the stability period, if they drop down and they work less hours and they're not full-time anymore, they still get coverage during the standard stability period. All right? Now, for those employees who failed to meet the minimum hours threshold during the measurement period, they are not considered to be full-time. You don't have to offer them coverage. It will not trigger any penalties at all. Now, a few rules. The stability period can't be shorter in duration, number of months, than the associated measurement period. So if you pick a 6-month measurement period, the stability period must be at least 6 months. If you pick a 12-month measurement period, then the stability period must be 12 months. So again, if the employee meets the minimum threshold during the measurement period, then the ensuing stability period for coverage availability must be at least 6 months. So if you pick a 3-month measurement period, they must be offered coverage for at least 6 months. And again, if the employee does not meet the minimum hours requirement, stability period can't be longer than the measurement period. Now, involved in that, this is optional. You can also have what's called an optional administrative period. This is a period where you sign them up. It tends to be at the tail end of the measurement period. This is where you, basically it's an open enrollment period. So as this says, the safe harbor allows an optional administrative period between the measurement and stability period so employers can notify employees qualifying for coverage and handle enrollment. And this administrative period cannot exceed 90 days or be applied in a way that imposes a gap in the employee's coverage. Now, the uniform periods cannot, you can vary it between collective bargaining units, salaried versus hourly, and employees located in different states. The IRS a few weeks ago eliminated the third choice, employees working in different entities. Please eliminate that. So for ongoing employees, the measurement periods are called standard. There's a standard measurement and stability periods. So the measurement and stability periods that the employer selects to apply to its ongoing employees are called standard. And the optional, where the employees decide to use this option, the administrative period can't reduce or increase the length of the standard measurement period. And to prevent any administrative periods from causing any gaps in the person's coverage, the administrative period must overlap with the prior stability period. Now, so far, this sounds like a lot of gobbledygook. Oh my God, how am I going to do this? And let's say we have a situation where somebody's plan year begins 1/1/2014. They have to get up and running fairly quickly. So how does this work? Well, first of all, this person decides to start their standard measurement period from 10/15/2012 to 10/14/2013. They've decided to use a 12-month period. They have a administrative period from 10/15/2013 to 12/31/2013. So it's a fairly long period, and remember that measurement period cannot be longer than 90 days. Now the stability period, and this will apply to any employer that has a calendar year plan year. This is the period of time where you have to offer coverage to the employees. And in this situation, the stability period runs from 1/1/2014 to 12/31/2014. Now what happens is the employer determines at the end of the standard measurement period ending 10/14/2013 which of their part-time and seasonal employees are full-time. They sign them up during the administrative period from 10/15/2013 to 12/31/2013. And they offer them coverage during starting 1/1/2014. Now, please remember, and this is an important point, the employee continues to have coverage during that stability period, even if that person's hours drop down to part-time. And that standard stability period, again, if you look at that, is 12 months, the same thing as the standard measurement period. Now, at the end of the standard stability period, which ends at 12/31/2014, we look back and see if that person's full-time. So the second standard measurement period for this employer is from 10/15/2013 to 10/14/2014. And we determine whether that individual was full-time. Now, if their hours dropped below full-time during the stability period, and we looked at the standard measurement period and their hours are not full-time, what happens as of 12/31/2014, the employer would no longer have to offer them or treat them as an active employee. And because they're no longer considered to be full-time, then going on from 12/31/2014, they would have to offer that employee COBRA because they're no longer full-time. So since their hours dropped in this situation, they would have to offer them COBRA. Now this is again, this has to happen every year. So I've just showed you cycle 1, cycle 2, and then there's going to be cycle 3 that begins at 10/15/2014. And this is a yearly occurrence. So this is an example of an ongoing employee safe harbor and a calendar year plan. Now a second safe harbor applies to new employees. And this safe harbor has a simple rule for new employees expected to meet the threshold for their start dates. Now this is important. You have to determine when you hire someone whether that person is going to be a full-time employee or a variable hour employee. If you determine at the hire date that person is a full-time employee, the longest period of time that person can wait to enter your plan starting in 2014 is 90 days. Now what I would advise you to do in this situation, if you hire somebody and you think that they're a variable hour employee, but you look back after working 2 months, and by golly, they're working full-time on a steady basis. What you may want to do in that situation, and if you see there's no change in hours over the next month, then at the end of the 90-day period, I would offer them coverage and change their status from a variable hour to a full-time employee. Now, for ongoing employees, as slide 23 indicates, the employer must establish separate initial measurement and stability periods for new hires that overlap with its standard measurement period and stability periods. So this is a second safe harbor and applies to new employees. Now again, as I indicated before, and this is important, if you have any new employees that you hire that you know they're going to work full-time, then what you have to do is the longest period they can wait is 90 days. But sometimes it's not clear when you hire them whether they're going to work 90 days. That's why I'm suggesting after 2 months you look at their hours and see if they're working full-time. Now you have a choice after 2 months. You can either have them continue full-time and offer them coverage after 90 days or reduce their hours and make sure they're not working full-time for the rest of the measurement period. Now, in this situation, the initial measurement and stability periods, are unique to each new variable hour or seasonal employees. And generally, these periods, like on the standard period, the employer picks it here. These periods start at the beginning of their employment. Now, what you can do in that situation to cut down any administrative nightmare is have their initial measurement period either beginning on their hire date or the beginning of the month following their hire date. That's to start their standard, their initial measurement period. Now, several limitations however, must be considered in setting up these periods and measurement. These restrictions are highlighted. The initial measurement period and administrative period combined cannot exceed beyond 13 months plus a fraction of a month. And new employees' initial stability periods can't be shorter than the standard stability periods. In an operation, this restriction will generally require a 12-month initial stability period for new hires if the employer uses the 12-month standard stability period. And then once a new employee has completed the initial measurement period and an entire standard measurement period, the employee can be tested as full-time. Now, once they've completed the initial measurement period, then they are thrown into the standard measurement period. So starting with the standard measurement period, the employee's full-time status is determined the same time and the same conditions as ongoing employees. Now, this sounds like gobbledygook right now, but let's skip a couple slides first And let's look at this, because I think without this slide, it's going to sound almost incomprehensible. Let's look at this. We have Jim. Jim is hired on 5/10/2014. Now remember, in Jim, his initial measurement period starts on his hire date, and an employer can pick that. So here, the employer decides to do 11-month initial measurement period followed by a single administrative period. So here, Jim's hire date is 5/10/2014. His initial measurement period is from 5/10/2014 to 4/9/2015. The employer decides to do a measurement period from 4/10/2015 to 6/30/2015. And the initial stability period runs from 7/1/2015 to 6/30/2016. Now, for Jim, the employer decides during his initial measurement period whether he works full-time. If he does work full-time, then he offers him coverage, and he signs him up, the employer, on the administrative period from 4/10/2015 to 6/30/2015. So Jim gets coverage from 7/1/2015 to 6/30/2016. Now, once he goes through one initial cycle, and this is what I wanted to illustrate, then what happens is the fact that now Jim is thrown into the employer's standard measurement cycle. And just like in the previous example, this employer has a standard cycle from 10/15/2014 to 10/14/2015. And here, the administrative period is from 10/15/2015 to 12/31/2015. And in order for Jim to have any coverage after 6/30/2016, the employer has to look back and see if Jim is full-time during their standard measurement period. If Jim is full-time, then Jim is offered coverage from 7/1/2016 to 12/31/2016. And after that, he is thrown in back into the employer's second standard cycle. Now, suppose we have a situation where the employer changes their mind, and in this situation, it's a variable hour employee, calendar year plan, 12-month initial measurement period using split administrative period. And in this situation, Jim starts at 5/10/2014. The employer decides to start the measurement period at the beginning of the month. So what that does, it reduces the administrative period from 6/1/2015 to 6/30/2015. Because the employer uses the 12-month initial measurement period, the initial stability period is 12 months from 7/1/2014 to 6/30/2016. Now, if Sam wants to be offered coverage after 6/30/2016, the employer has to look back and see if Sam worked full-time during the employer's standard measurement period. And here, the standard measurement period is from 10/15/2014 to 10/14/2015. And so, Sam would, if he's full-time during that standard measurement period, would be offered coverage from 7/1/2016 to 12/31/2016. And then if there's going to be coverage after starting at 1/1/2017, the employer would have to go back and look and see if if Sam is full-time during the second standard cycle. As you can see from this, it's extremely complicated. The only way I think to illustrate this is to go through these examples to see, and the most difficult part of this is right here. If you have people that are hired on a pretty consistent basis, you have to sit down with your payroll company and to make sure you can measure these hours to see exactly what your responsibility is going to be and how many of your employees are variable hour employees, how many employees could be considered full-time, and how many are part-time. I'm helping many restaurants and fast food industry to look at this to see the best way to handle this. Let's go back on a couple of slides. So starting with the standard measurement period, the employee's full-time status is determined at the same time and using the same conditions apply to ongoing employees. What that means is that after the initial measurement stability periods, as those examples show, then in order to get continued coverage after the initial stability period, you have to see if that person is full-time during the standard measurement period. So an employee who meets full-time status during the initial measurement period must be treated full-time during the entire initial stability period. But again, if they fall below the hours, then they're probably going to lose coverage and not be offered coverage during the standard stability period. So if the employee fails to meet full-time status during the initial measurement period, then what this slide is trying to say, they're not treated as full-time, but again, you have to throw them back into the standard measurement period, and sometime in the future, if they get enough hours, they could be offered coverage during that standard measurement period. Now, again, for new variable hour or seasonal employees, the 90-day limit on any administrative period uses total days between start date and date that the employee is first offered coverage. This means an employer choosing to simplify tracking by starting on the initial measurement period must take this in consideration. I showed you this example and this example. So again, when to start measuring hours. Depending on when your plan year starts in 2014, as I said before, if your calendar year, if your plan year is a calendar year, you can pick any 3 to 12 month period. But if you're a calendar year plan, you have to start offering coverage as of 1/1/2014. And as I said in the beginning, what the IRS has indicated, you can pick a 6-month period in 2014 and pick a longer period for 2015 and later. Now, in talking to employers and looking at their situations, generally I found that picking a longer period gives you more flexibility in not offering coverage, because if you pick a 12-month period, it's 130 hours per month or 1,560 hours. In this situation, if you pick a longer period of time, it gives you more flexibility in the later months to reduce their hours so they don't come up to that 1,560-hour threshold. So for employers with large number of short-term employees, shorter measurement period and stability period may be optional. And again, it's time to start looking at your situation, especially if you have some employees at variable hour, and see what the damage is going to be starting in 2014. But again, and looking at many employers in the past, a 12-month period is generally the best way to go. So in order to look at this, employers may want to consider the following: decide whether and how to adjust plan waiting periods, gather data to determine whether and how the safe harbors are relevant, consider safe harbor approaches and offering coverage in 2014. If using safe harbors, determine the optional measurement, administrative, and stability period. And anything you do starting in 2014, always amend plan documents and related SPDs to reflect exactly what you're doing. All right, additional Medicare tax. Starting in 2013, there's going to be a second level of Medicare tax. Currently it's 1.45 for those individuals whose income exceed 250 in case of a joint return, 125 in case of married filing separately, or 200,000 in any other situation. there's going to be an additional Medicare tax of 2.35. This is how it's going to work. So in 2013, a single individual with wages of $230 will owe a hospital tax of 1.45 in the first $200,000, 2.35 in the remaining $30,000. You as an employer don't have to withhold additional taxes unless their income is that exceed $200,000. But what I would try to do in this situation, especially if you know a spouse earns a lot of money, you may not have to withhold additional taxes, but they're going to have a surprise when they file their taxes for 2013. Now, this 1.45 rate doesn't change for the employer portion of a tax. If an employee is self-employed, the additional 0.9 applies to self-employment income that exceeds that dollar limit. But again, you can't deduct that additional amount. Medicare tax and unearned income, this is the most controversial tax. There's a new tax of 3.8%. This is not part of the fiscal cliff deal. This additional tax applies to net investment income and only on those individuals earning $250 or more in case of a joint return, $125 in case of married filing separately, or $200,000. If your income is below that level, that tax doesn't apply. As soon as your income goes above that level, all your net investment income is subject to this new tax. That's net investment income is a sum of gross income from interest, dividends, annuities, royalties, rents, other gross income derived from any business which the tax applies, and then that gain attributable to the disposition of property other than property held in a trade or business. Net investment income does not include any distributions from IRAs or retirement plans. Now, there's a new requirement starting in 2013, March of 2013, called a notice of the exchange. Supposedly it has to be distributed beginning of March 1st, 2013. It has to be given out to all existing employees and every new employee after that. As I said in the beginning, we don't know how this is going to be applied because nothing has been released yet. And only a few states, only 17 states, have actually started establishing exchanges. So please note here that this requirement probably will be delayed until June of 2013, but no official word has come out on this yet. So please, I've been getting a lot of calls on this, and please make sure that you follow and see if this has been delayed. So what does this notice do? What is it going to look like? It's going to tell employees of the existence of the exchange, that they may be liable for any premiums, credits, and subsidies. But if they purchase a qualified health plan on the exchange, they will lose any employer contributions. So we don't know at this point whether there's going to be a separate notice for each exchange or one notice, and then all the information on the exchanges will be attached to it. So stay tuned for this requirement. Another new fee is the comparative effectiveness fee. I call this the PCOR fee. And this is paid by certain health insurers and applicable sponsors of self-insured plans. It only applies to health plans. It doesn't apply to dental and vision plans. So this applies for the first plan year ending after September 30, 2012. If you're insured, the insurers will file the reports and pay the fees. If you're self-insured, for example, if you use an HRA, you'll have to pay the fee. Now, plan sponsors and insurers will file a Form 720, and it will be filed each year by July 31st of the calendar year immediately following the last day of the plan or policy year. So if your plan year ended December 31st, 2012, the first payment is due by July 31st, 2013. So what is the fee? The fee the first year is going to be $1 every covered head, and then increases to $2 a head for every year after that. Now, again, it's based on the average number of covered lives, which means all individuals covered by the plan. Now, let's look at the changes in 2014. Let's look at the employer mandate. So beginning in 2014, certain large employers are going to be penalized if they don't offer their full-time employees and their dependents minimum essential coverage, or if they offer it, it's unaffordable, or it doesn't meet the requirements of minimum essential coverage, which means the plan doesn't cover at least 60%. Now, the penalty tax will be due if any full-time employee is certified by the employer as purchased health insurance through the exchanges. Now, what is a large employer? A large employer is anyone who's employed at least 50 full-time employees on any business days during the preceding calendar year. So we have to look at 2013. Now, what the IRS has indicated is we'll look at 6 months in 2016. It doesn't have to be the entire calendar year. Now, if you are employing a lot of part-time employees, you're not off the hook. So in determining the number of full-time employees, an employer must add up the total number of hours worked in a month by part-time employees divided by 120, and add that number to the number of full-time employees. And you say to yourself, wait a minute, Larry, in the previous section you said full-time was 130. 130 is used to determine full-timeness for offering coverage. There's a different figure to determine whether you're a large employer. So in this situation, if you have an employee, let's say they have 10 full-time employees and 200 part-time employees. We take those 10, we take the average of the part-time employees, and if that average, that 200, comes up to 45 full-time employees, that employer now has 55 full-time employees, and that employer is subject to the mandate. But please remember, the employer is only obligated to offer coverage to full-time employees and their dependents. The part-timers are only added in here to determine whether that employer is a large employer. Please remember that. Now again, there is a transition relief for purposes of applicable large employers determination for 2014. And as I indicated before, instead of a 12-month period and taking an average, what you can do in this situation is take 6 months. So an employer may determine whether it's applicable large employer by determining whether it employed on average of at least 50 employees on business days during any consecutive 6-month period in 2013. So you can pick any 6-month period, determine how many, in each month, how many employees you had. So you take those 6 months, you see how many employees you've employed during that 6-month period, take an average for each month. And if that average is 50 or more, then you're subject to the employer mandate. Also, there's a special safe harbor for those employees who are only large because of seasonal employment. Under this rule, an employer will not be considered to employ more than 50 full-time employees if the employer workforce only exceeds 50 full-time employees for 120 days or fewer during the calendar year, and 2, the employees in excess of 50 were employed during the 120-day period. Now, with the IRS has indicated that that's a 4-month period, it doesn't have to be consistent. Now, what that means is, for this purpose, if you're only full-time during 4 months of the year because you hire a ton of seasonal employees, then those seasonal employees for this purpose only are ignored. Now, who are considered employees? What this slide trying to indicate is the fact that a common law standard, which means that do you have control over the employees? I've been asked many times in this situation, well, I'm going to make all my employees 1099. Not so fast. If you have the ability to control those employees where they're working, the IRS will consider those to be your employees in their common law. please don't go willy-nilly categorizing employees that are full-time, that are 1099. Please be careful. Talk to your attorney. See if it's feasible in your situation. If an individual only works for you during certain parts of the year, it's going to be really, really tough to categorize those employees as independent contractors. Now, the second question is, how are hours counted? And basically what the IRS has indicated is you count all hours. You count records for worked hours for payment. You count hours during which they get vacation, holiday, illness, incapacity, jury duty, military duty, or leave of absence. So if somebody is on a paid leave of absence, they are considered to be working. Well, you say to yourself, how can you count hours when many of our employees, we don't count hours? And what the IRS indicated is they've created 3 safe harbors in this situation. You have a choice, and this is covered on slide 56. You have a choice of 1, counting actual hours, 2, using days worked equivalency. If somebody works a day, then they get 8 hours, all right? Or using weeks equivalents, which means if they work a week, they get 40 hours. Doesn't matter in actuality. But what the IRS is indicated, you can only use these standards if it really reflects reality. What does that mean? It means that if you know that your employees always work 10 hours a day, 50 hours a week, you can't use the 8 hours and 40 hours. You have to use the what they work in actuality. So this was put here, and these are the same rules that apply to qualified retirement plans and counting hours. They're the same rules. Now, suppose you decide, you're a large employer, and you decide that you're no longer going to offer coverage. All right, you're going to terminate your plan, walk away. I'm going to give my employees so much per year, and I'm going to be the end of it. What happens to you? For any month that you don't offer coverage, the penalty is going to be $166.66. That is 1/12 of $2,000. For the year, you're going to be penalized $2,000. But as the top of the slide indicates, the penalty is only applied for every full-time employee beyond the first 30. All right? So I'll give you a couple examples. Suppose you have an employer with 100 employees. They decide not to offer coverage. You take that 100 employees, subtract out the 30, leave 70. That employer, if they don't offer coverage, the penalty would be 70 times 2,000, or $140,000. All right. Now let's take another example. We have a situation where you had 10 full-time employees and 200 part-time employees. All right. And we total up the number of part-time hours, and they come up to 55 employees. They're subject to the mandate. But their responsibility to offering coverage is only to full-time employees. They only have 10. So in this situation, even though the employer is a large employer, they're not penalized because that's 30 employee reduction. So please remember that. Now, in the proposed regs that came out at the end of December, there is a special rule for those of you who are a control group and have various entities in the control group. And what they indicated, and this is explained in the employer mandate explanation, is that this employer mandate requirement applies individually to each division. And when you're applying the 30 employee reduction, you apply it pro rata across the different divisions. You can't give that one division the 30-hour reduction and not give it and not divide it up. That's what this is saying. So the application to control groups on a pro rata basis. So let's say, as an example, you have a division, and each division has 40 people. And so you have 120. They're subject to the mandate. What I'm trying to say here is that whether any employer is going to be penalized with the IRS, that it applies separately to each division. So let's say 2 divisions decide to offer coverage, the 3rd division does not. There's a possibility that only that 1 division will be penalized, but applying the 30 employee reduction, it's 10 per division because there's 3 divisions. So that's how it would be applicable in a control group situation. Now, in a situation, another situation that an employer could be penalized is if somebody decides to offer coverage. And the other rule is that you have to offer affordable minimum essential coverage. What does affordable mean? It means it cannot exceed 9.5% of their household income, and the coverage must be 60%, cover 60% of the cost. Now, if an employer, and this is going to be a challenge if the employer's coverage is not affordable, in this situation, then the employer will be penalized. And the employer will be penalized $3,000, but only for those employees that go on the exchange and get a subsidy. So let's go back to my example. You have a company that has 100 employees, and they offer coverage, and the coverage is not affordable. It exceeds 9.5%. But only 3 employees go on the exchange. Then in that situation, the employer is only penalized $9,000, not the $140,000 I said before. But let's say that everybody goes on the exchange. All 100 employees go on the exchange. What is the penalty for the employer? And the penalty tax can never exceed the amount if they didn't offer any coverage at all. So if all employees went on the exchange, they're not going to be penalized $300,000. They're only going to be penalized $2,000 minus the first 30. Now, in this situation, how can you determine whether that coverage is affordable? And what the IRS has indicated is the fact that you, as an employer, won't know what the household income of the individual is. There's no way. So it's unrealistic. So what they've done basically is created 3 safe harbors that you can use, and you're off the hook if you use them. First safe harbor is Form W-2 wages. It's 9.5% of Box 1 of the W-2. You can look at last year, you can look at this year, but as long as you use that, there's no problem. They've created a second safe harbor, the rate of pay affordable safe harbor, where you basically apply that 9.5% to the rate of pay, and if you know that person's pay is not going to be reduced, you base it off of that. And lastly, there's the federal poverty line safe harbor, which says if somebody is at the poverty level, it's 9.5% of that. An explanation of these safe harbors is in the explanation of the employer mandates. And because I'm running out of time, please look at my explanation. Now, the way it's going to work in 2014 and 15 is the fact that they're going to look at the information provided the exchanges, and they're going to notify you of any employee went on the exchange. So you're not going to. So first of all, you're going to be notified if any of your employees go on the exchange. So when the employee determines the applicant is eligible to receive advance payments, again, they're going to notify you that the person got a premium payment. But you say to yourself, how are they going to know this? Well, you're going to have any large employer has to report health coverage to the IRS, and this will happen in 2015. So the reporting employers must also provide related written, must provide information to the IRS. What is this? Well, the reporting and statement requirements apply to coverage provided after January 1st, 2014. The first information return will be filed in 2015. And the IRS will use this information to verify any employer-sponsored coverage. It applies to any large employers. And this is the information you have to give to the IRS. The employer's name, date, employer ID number, certification of whether the employer offers full-time employees and their dependents the opportunity to enroll in a minimum essential coverage, the number of full-time employees, the name and address and tax ID number of each full-time employee, and the other information required by the IRS. This other information includes months during the calendar year in which the coverage was offered, monthly premium, employer's share of total cost, the length of any waiting period, and the option of which the employer pays the largest portion. Now, in addition to that, once you follow with the IRS, what you have to do is the following year summarize that information and give a report to the employees of exactly what information you gave to the IRS. And that is due on or before January 31st of the year following the calendar in which the information was required to report it. So if it was required to report it in 2015, you'll have to do it in 2016. Now, please remember that 90-day period applies for plan years beginning in 2014. Every plan has to adhere to it, and remember, it's a hard 90 days. Pre-existing conditions. Pre-existing conditions, as we know, it goes away in 2014. As I said before, it probably will not be a big deal to group plans, but be a much bigger deal to individual plans, and your COBRA participation will probably go down. Now, starting in 2014, there's going to be employer mandates. Now, in the small individual plan markets, this means that plans with under 50 participants, these are the factors they will use to determine your premium. Whether the plan or coverage covers individual or family, rating area, age, tobacco use. What's not included in this, and that means every plan is community rated, is your employer experience. Remember, this only applies to individual small plan markets. Also, any premiums for older individuals cannot exceed 3 times of young adults. This means that if you have good experience in the past, probably your premiums will go up. Also, there's going to be a requirement that in 2014 on the individual small plan markets that you offer essential health benefits. This does not apply to grandfather plans. So you have to provide essential health benefits, you have to limit cost sharing, and you have to either provide a bronze, silver, gold, or platinum level coverage, which means actuarially it translates to 60, 70, 80, or 90% of full actual values under the plan. And this is the definition of essential health benefits. These are 10 categories. It will vary from state to state of exactly what's included. But these are the factors that we've included in all plans, both individual and small plan market. Also in the individual and small plan market, there's going to be cost sharing requirements, both on deductibles, co-pays, co-insurance, and on deductibles. So there's going to be a limitation on out-of-pocket, the same thing for a high deductible health plan. So for deductibles, co-payments, I cannot exceed $6,250 for individual coverage and $12,005 for family coverage. Also, for annual deductibles, it cannot exceed $2,000 in case of single individuals and $4,000 in case of any other. And again, this only applies to non-grandfathered plans in the single and small group market. Wellness programs. As I said before, starting in 2013, if you offer a wellness program, a standard-based wellness program, the incentive is increased from 20 to 30%. And if you offer a smoking cessation program, the benefit or the penalty can be as high as 50%. Now, individual plan market. Remember, if your responsibility as an employer is to only offer coverage to your employees and their dependents. they don't have to take it. But if they don't take it, they're going to be subject to an individual mandate. And that will kick in January 1st, 2014. And the tax penalty will assess against any applicable individuals who, after 2013, do not have minimum essential values. And these are the various plans that can operate not to be penalized. So what is the penalty? The penalty is the greater of $695 per year up to a maximum of 3 times that amount of $2,085 per family, or 2.5% of household income. But the penalty doesn't kick in right away. It's only $95 in 2014, $325 in 2015, and $695 in 2016. But there is a myriad of exemptions from this penalty. You can have a religious conscientious objection penalty, members of a healthcare sharing ministry, individuals who are not citizens, and incarcerated individuals will not be subject to this penalty. Also, all these other individuals will not be subject to the penalties. Individuals who cannot afford the coverage, individuals whose household income does not exceed threshold for filing a federal tax return, members of certain Indian tribes, and individuals who have a gap in their coverage of less than 3 months, or those who have extended hardship exemption. Now, the $64,000 question is, what are the exchanges and how they work? Well, by 2014, there's supposed to be state American health benefit exchanges. And if the state doesn't establish an exchange, then the feds will do it for them. Now, the feds will perform various functions, including certifying qualified health plans, determining eligibility, and for insurance affordability programs, determining whether individual is subject to premium credits and responding to questions. The state-based exchanges must be a governmental entity or a nonprofit entity, and the states have some flexibility in their design. They may establish an exchange as a state agency or not-for-profit. They could go for one exchange for the entire state or various exchanges in various regions of a state. And the federal government has granted grants for them to establish an exchanges. Now, again, there's 3 ways of establishing an exchange. The state can do it. They can do a partnership with the feds, or the state, or the feds can do what's called a federally facilitated exchange. Excuse me. Now, these are all the duties that the exchanges will do. They will certify, recertify, and decertify qualified health plans, assign relative quality and price ratings, provide standardized consumer information, create an electronic calculator, operate a website and toll-free call center, determine eligibility for the exchange tax credits, determine exemptions for individual mandate, and establish a navigator program. And again, the states may choose to do a partnership, as I indicated before. Now, currently, only 17 states have established an exchange. 3 have done through executive order. Majority of states have established appointed boards. So what have states have done? Illinois is going to do a partnership with the feds. Wisconsin hasn't done anything, and it has returned money. Indiana is not doing anything. The new governor has not determined what they're going to do. And lastly, Michigan is going to do a partnership with the feds, where they do certain functions and the state does certain functions. But only individuals and small employers will be eligible for the exchanges in 2014. And each state will determine what a small employer is. It's any number from 50 to 100. Many states have determined 50. Now, in order to be eligible for the exchange, you have to be a citizen, national, or non-citizen, lawfully present and reasonably expect to remain in the state, and not incarcerated and reside in the state that established an exchange. You can't go around the country looking for an exchange. There's also going to be a small business health option where small businesses can purchase group coverage, and there's going to be special services for small businesses. Now, there's also going to be individual premiums and credits on the exchanges. There's going to be 2 forms of financial assistance. There's going to be premium credits, and there's going to be cost-sharing assistance. Premium credits means they're going to get assistance with paying for the coverage. For those with the lowest income, less than 133% of the poverty level, the tax credit amount is based on limiting the individual's premium to no more than 2% of income. And for those between 300 and 400% of the poverty level, the tax credit is based on limiting the contribution to 9.5% of income. Also, individuals, depending on their income, will get assistance with out-of-pocket deductibles and copays. And for those with incomes between 100 to 200% of the poverty level, the reduction is 2/3. And for those, and for all others, it could be 1/2 to 1/3. Also, there's employer premiums and credits, but again, it's only for small employers. It's up to 50% of the premium. The definition of an eligible large employer is not more than 25 full-time employees, and their annual wages cannot exceed $50,000. Just note here that very few employers ever qualified for this. Lastly, clinical trials. Starting in 2014, every non-grandfathered plan has to cover clinical trials, both insured and self-insured. Now, please note this could be very expensive, and if a provider of a participant says they would benefit from a clinical trial, as this slide shows, you cannot discriminate against them and not cover them. So what should employers do? Large employers, is it cheaper to terminate a coverage and pay a penalty? Determine who is a full-time employee, and does your coverage meet requirements of essential coverage? It covers 60%. Most currently do. And is your coverage affordable? And that's going to be the challenge. Small employers. Can you as an employer afford coverage? Should employees be encouraged to go to the exchange? And what about going to a private exchange? And you'll see interest in that and information on that. Remember, you can't get any credits and subsidies on the exchange. In 2013, apply to the new limits to FSAs. Determine who is a full-time employee. Notify the employees of new Medicare tax, and notify the employees of the exchange. Large employers, 2014, continue to offer coverage? Should you? And small employers, can you afford group coverage? Determine which employees are eligible for credits and subsidies. It could be cheaper for your employees not to offer coverage. And remember, employer mandates include covering the dependents.
Hello, everybody. This is Greg Sutter from Strategic Services Group. I want to start off by thanking Larry for an outstanding presentation. Here at Strategic Services Group, we'll be conducting 5 more presentations throughout the year. We'll be sending notifications to everybody. And here at Strategic, what we do is we're a benefits consulting agency. We specialize in compliance. We specialize in HR administration, employee benefits consulting. And now what we're going to do is we're going to open it up for Q&A, and Larry's going to conduct and do his best to answer all questions from everybody. And if you need a copy of this presentation, you can contact us or Larry, and we'll be happy to provide you a copy of today's presentation. And again, thank you for joining us today.
For those of you who bear with me a second. The last slide, that's my contact information. So if you want a copy of the presentation, and again, my explanation of the employer mandates goes into detail. And as you can see from the information, and what we're going to do in future seminars is drill down in each of these topics. So you won't be alone in understanding exactly, but we want to do a general overview in the beginning. If a small employer is less than 25 full-time employees and a large employer is over 50, what about those of us with 26 to 49 employees? Where do we fall, and which rules will apply? Well, in that situation, if you're under 50, all right, there's no employer mandate. But if you're going to offer coverage starting in 2014, as I indicated, there's going to be new requirements for the insured plans. the deductibles, co-pays, co-insurance, especially if your plans are non-grandfathered. Now, the second issue for small employers, which you have to face is, and you have to look at the income levels of your employees, would you get a better deal? Would they get a better deal on the exchange if you drop coverage? And this is a $64,000 question that many employers are wrestling with as we speak. Is allowing of a per $25 limit, we understand that it combined does not exceed. In this situation, it only applies to salary reduction contributions. It only applies to salary contributions to FSAs. And it only applies per individual. It doesn't apply to employer contributions. So these are rules that are extremely important. And again, if you want more information on the rules on health FSAs, I just touched the surface, please send me an email. I can send you those rules. After an employee meets the measurement criteria, doesn't meet the hours during the stability period, when will they no longer be eligible for group coverage through your company? Well, if they meet the hours requirement during the measurement period, then what happens is they're granted, you have to offer them coverage during the stability period. Then at the end of the stability period, the employer has to look back. And if that person continues to be full-time during the standard measurement period, then that employer continues to offer them coverage during the next stability period. If an employee now is considered full-time but is covered under the spouse, are we still bound to offer coverage? And yes, they can turn it down. Please remember that. Your responsibility as an employer is to offer them coverage to the employee and their dependents. And I just want to stress to you that 9.5% criteria only applies to individual coverage. You have to offer coverage to the family, but you only, again, your responsibility is 9.5% of a single coverage. Is there any known payroll providers or software companies that will be offering a service to track? It's been my experience. I talked to many of my clients. Many of the major payroll companies have services that do this. You have to, if you have a local payroll company, a smaller payroll company, you have to ask them whether they're going to be offering services to count hours. Some do, some don't. So you have to be very careful.
Larry?
Yes.
This is Roger from Strategic Services Group. We have a great option for those who are interested.
Okay, good.
Thank you.
We have multiple restaurants, and they have separate ID numbers and are separate corporations altogether. What if one of our employees works 20 hours on one location and 20 hours at another location? Would they qualify for being full-time? These individuals get a separate W-2 and technically work for separate companies. I would think in that situation, the IRS said you would have to treat them as a full-time employee because they work under a control group situation. For that purpose, it is treated as one employer. You have to decide in that situation, if they are full-time, which of the restaurants will cover them. Okay? That would be too easy of a dodge. What about control? Common control, we have separate companies, separate ID number with less than 25 and the same owners in both. All this is determined on a control group basis. And again, people have indicated about whether they're going to get a copy of the presentation. I sent an email out earlier last night with a copy of the presentation and with an explanation. If you didn't get a copy of that, please email me. That's my email address. And I can email you a copy of that. And again, you should have gotten it either last night or this morning, so way before the seminar. So if you didn't get it, let me know. How does regard to full-time interns? There's a special role for that. Send me a question and I will give you the answer to that. I don't want to waste time going through this. If we, even if we know that the seasonal employees will be working 40 hours for 4 months, do they still qualify under the variable hour employees? And the answer is no. You have to pick a longer measurement period. You have to see exactly how many hours they work during that measurement period. And they have to work on average 30 hours during that measurement period. So if they pick a 12-hour, you pick a 12-month measurement period, it's 1,560 hours. And you have to look and see on average what they worked at. So whatever measurement period you pick, try to pick a longer one. Who is considered to be dependent? It's dependent children. It's not going to be your spouse. So it's dependent children under age 26. And Roger, that's the last question. Do you have anything else you want to talk about, or?
No, Larry, but again, thank you for all that you've done and your presentation. We look forward to the next 5 presentations. And again, we want to reinforce that if anyone has an option or needs an option in the payroll side to track these types of things that they need to track and report on, we have that available. They can contact me here at Strategic Services Group. Our next webinar is March 14th, 10 a.m., and we look forward to everyone joining us. Thank you.
Thank you. Take care.
Bye.